All right, well, in studio now with us, we have Katie Peters, a nurse with the Panama Buena Vista Union School District. How are you today?
I'm good. How are you?
Excellent. So you are part of the Health, Safety, and Wellness program at the district.
Yes, that's correct.
So what does that all entail? Because is that a little something more than just what we think of as just nurses on campus?
Yes, it's nurses, it's employee safety, student safety, just all around wellness for everybody who's involved in the district.
Okay. And as a school nurse, you're busy with who knows what every single day, right?
Yes, very busy.
Okay.
Part of what we do that is really important are vision and hearing screenings with our students every year.
When do these usually take place?
These usually take place in transitional kindergarten. We do vision only in kindergarten, 2nd grade, 5th grade, and 8th grade. So those are the grades that the California state law mandates us to do screenings.
Okay. But if you see a student or a teacher has a referral, then obviously you will see them as often as needed.
Of course, anytime a teacher has a concern or even a parent has a concern,
Okay.
they can reach out to us and we can quickly do a screening and see what's going on with the student.
All right. Well, sound and vision, we're ready to check it out, so take it away.
All right. So why are screenings important? Vision and hearing are really critical to student learning. For vision, we want to make sure kids can see the board clearly and read clearly. About 80% of what students learn in school are through visual input. As far as hearing, we want kids to be able to hear the teacher and hear their classmates. It's really critical with hearing that we find problems early before they start to affect learning. And any time a school site team is seeing a student struggle academically, one of the first things they question is whether or not vision or hearing could be an issue that's impacting them in the classroom. So who gets screened when? We kind of talked about that a little bit.
Right.
So transitional kindergarten, 2nd, 5th, and 8th grades, or any time a vision or hearing, concern is suspected. We do this at every single site in the district, and we encourage parents and teachers to reach out to us if they're seeing any concerns.
So I've got a question for you now. So let's say you do a vision screening on a kid in kindergarten.
Gotcha.
And you recommend that they have some sort of eyewear that they are going to need to help them in class. How far does the responsibility go then, as far as you let the parents know, but then it's pretty much up to them whether or not this happens, correct?
It's true. Our ultimate goal, let's say a student has a vision issue and we send home a referral. We contact a parent, through the phone. We recommend that they go get screened. Our goal is to keep following up with them until we know they've seen a provider and then we know that they have glasses.
Okay.
So we will keep that follow-up till the end.
And in the meantime, the child can be placed in different parts of the classroom also.
Exactly, closer to the front if that helps, or whatever they need.
Okay.
So what happens during a screening? They're quick, they're easy, they're painless. I brought some of the screening tools with me here that we use. So this is an eye chart. This is what we use for distance screening with students. We have them cover one eye and then the other eye, so we're checking their distance vision
All right,
with
now,
it.
hold on. That's not the same eye chart I look at when I go to the eye doctor. So why are there symbols?
So symbols we use for most students in elementary just because they're more easily identifiable. So some students could struggle with numbers, and we screen students who are as young as 3 years of age, so symbols just tend to be a little bit easier.
You start obviously on the top line, or do you start different places?
We start at the top and we go down until we get close to 2032, because for the school setting, 2032 is considered passing for vision.
Okay, so 2032, and that's what a lot of students, you say, need, but a lot of students probably hear, well, yeah, I've got 20/20 vision. So what do the numbers mean?
So 20/20 is considered like perfect vision. 2032 means from a 10 feet distance. So let's say a student is sitting 10 feet away from the board, they can see what's on the board at 2032 visual acuity. So that would be considered, they're easily able to identify what's on the board.
And how far down does that go?
That is, right here is 2032.
All right. And what is the very bottom? What are the numbers?
The very bottom is what we wouldn't even use. Let's say I'll show you 20/20 is right here.
Okay.
Yeah.
So is this the only tool you use for vision screening?
It's not. So this is the tool that we use for distance vision. To check near vision or like you're seeing up close, we use this chart here. It has the same symbols. We just showed it to the student from about a 16-inch distance away from their face. So that's what we use this cord for. And we just ask them the same thing. So we try to have them see 2032. and that would be considered passing.
And is that considered the ideal distance for reading? You don't want a kid like that on a book, obviously, but
Not necessarily the ideal distance, but if they're not able to see, a book or what they're reading from 16 inches at that visual acuity, that would be concerning.
okay.
So I also brought with me this test for color perception, so how well students can see colors. So this is a screening that we typically do for students between first and second grade. In our district, we tend to do it in second grade, but it just has different
So are those
different
the ones
shapes.
with different numbers and things
Yes.
in it? And okay.
Yeah, so we use, these are different shapes, they're different colors, and we just ask students to tell us what they see, and if they're easily identified, then they pass.
Okay, so I see an O and an X.
Perfect, so we'd go on to the next page, that would be considered pass on that page. As far as hearing, we use a tool called a pure tone audiometer.
What was that?
A pure-
I'm only kidding. I'm like,
It's called a pure tone audiometer. These are headphones. We put them on the student. They play different beeps at different pitches and volumes. And
seeing
the-
how high or low they can detect.
Exactly, and students just raise their hand and let us know if they heard it, and that's all there is to it. It's a really easy way to identify any hearing issues.
And how long does that process take?
This takes, if students easily understand directions, 5 minutes, not
Okay,
even.
and as far as the numbers go, are there certain decibel levels you're doing or different pitches, frequencies, things that you're doing?
Yes, so we have 3 different pitches that we use. We do right ear and left ear. And if they're able to hear at a certain volume level at each pitch, it's considered passing. If they aren't and they can only hear at a louder volume for a certain pitch, that would be considered a failed screening, and then we would re-screen them in 2 to 6 weeks. And the reason for that is students could have like a cold, upper respiratory infection, they could
I was
have
going
more
to say
fluid
something
on
could be
their
a little
ear.
bit off that day or whatever.
Exactly. We have lots of kids who say, oh, I've had a cold, or you can hear them coughing while you're doing the screening. And if they fail, it's a good indicator that, okay, maybe if I rescreen them in a couple weeks, that'll clear up and they could pass.
All right. Well, certainly a lot of information right there, Katie. Thank you for coming in, sharing with us some of the sound and vision that a lot of students go through once they start school. And then obviously every other year, it seems like, when they're doing this also.
Yep, pretty regularly.
All right. We'll be back with more right after this.